Artificial methods. Oral contraceptive. Oral contraceptives, birth control pills, are hormones containing medications that are taken by mouth to prevent pregnancy. They prevent pregnancy by inhibiting ovulation and also by preventing sperm from penetrating through the cervix. Advantage of oral contraceptives is it does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. Disadvantage is the most common adverse effect of combined oral contraceptive pills is breakthrough bleeding. Women will also complain of nausea, headaches, abdominal cramping, breast tenderness, and increased vaginal discharge or decreased libido. Side effect of oral contraceptive. Breakthrough bleeding or spotting, more common with continuous dosing or extended cycle pills. Transdermal patch. A transdermal patch acts as a carrier for a drug, holding it until it's applied. At the point of application, the patch's adhesive secures it to the skin, and the drugs contained in the patch will begin to permeate into the bloodstream. Advantage of transdermal patch is including smooth, continuous drug delivery, increased bioavailability, and reduced drug-drug interaction. Disadvantage is it does not provide protection against sexually transmitted infections (STIs), including HIV. Side effect of transdermal patch. Difficulty falling asleep or staying asleep, headache, dry mouth, stomach pain, skin irritation, itching, swelling, or redness in the area where you wear the patch. Vaginal ring. To use a vaginal ring, you squeeze the ring and insert it into your vagina like inserting a tampon. Closing parenthesis. It stays in your vagina for 3 weeks. You then take it out and throw it away and wait 7 days before inserting a new ring. Advantage of vaginal ring is it doesn't interrupt sex, it's easy to put in and take out, and you don't have to think about it every day or each time you have sex. Disadvantage is you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in. Side effect of vagina ring, such as increased vaginal discharge, headache, nausea, breast tenderness, and mood changes. The ring doesn't protect against STIs. Subdermal implants. Subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. Advantage of subdermal implants is progestin implants include long-term contraceptive action with it requiring the user's or provider's attention. Low dose of highly effective contraceptive without the use of estrogen, and fertility is readily reversible after the removal of implants. Disadvantage is you may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Side effect of subdermal implants. Abdominal or back pain and increased risk of non-cancerous ovarian cysts, changes in vaginal bleeding patterns, including absence of menstruation, amenorrhea, decreased sex drive, dizziness, headache, mild insulin resistance, mood swings, and depression. Hormonal injections. The injection is also called depot. Depot prevents the body from producing its own hormones and releasing eggs from the ovaries. This is also how the contraceptive pill works. The injection thickens fluid at the entrance to the uterus womb, which stops sperm from entering. Advantage of hormonal injection is each injection lasts for either 8 or 13 weeks, it does not interrupt sex, and it's an option if you can't use estrogen-based contraception. Disadvantage is your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injection. Side effect of hormonal injection. Irregular menstrual periods or not periods at all, which is a side benefit of the shot, headaches, nervousness, depression, acne, change in appetite, weight gain, excessive growth of facial and body hair. Intrauterine device. An intrauterine device (UD) is a small contraceptive device that is put into the uterus womb to prevent pregnancy. The two types available in Australia are the copper UD and the hormonaliad Miranam. Advantage of the intrauterine device is it protects against pregnancy for 5 or 10 years, depending on the type, and once an UD is fitted, it works straight away. Disadvantage is your periods may become heavier, longer, or more painful, though this may improve after a few months. Side effect of intrauterine device: spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during your periods, pain when your UD is put in, and cramping or back aches for a few days after. Chemical barriers. Chemical barriers also protect against infection by pathogens on the outer body surface, at body openings, and on inner body linings. Sweat, mucus, tears, saliva, and breast milk all contain antimicrobial substances such as the enzyme lysozyme that kill pathogens, especially bacteria. Advantage of chemical barriers is condoms protect against pregnancy, and barriers methods are safe to use while breastfeeding. Disadvantage is do not prevent pregnancy as well as IUDs or hormonal forms of birth control. Side effect of chemical barriers. The spermicide used with the diaphragm can increase the risk of getting HIV from an infected partner. Use of the diaphragm and spermicide may cause vaginal burning and irritation from the spermicide. Use of the diaphragm and spermicide may increase the risk of urinary tract infection (UTI). Diaphragm. A diaphragm keeps sperm from entering the uterus by covering the cervix. For added protection, spermicide is put into the bowl of the diaphragm and along its edge before it's inserted. The diaphragm is placed high into the vagina so it covers the cervix. Advantage of diaphragm is you only need to use diaphragm cap when you want to have sex, and you can put it in at a convenient time before having sex. Use extra spermicide if you have it in for more than 3 hours. Disadvantage is it's not effective as other types of contraception, and it depends on you remembering to use it and using it correctly. Side effect of the diaphragm. From the spermicide, irritation of the vagina and surrounding skin or an allergic reaction, strong odors, or vaginal discharge if the diaphragm is left in too long, an allergic reaction to the material in the diaphragm. This rare, a higher risk for urinary tract infections (UTIs). Cervical cap. The cervical cap keeps sperm from entering the uterus by covering the cervix. For added protection, spermicide is put into the cap before inserting the cap snugly over the cervix. The cap can be put in several hours before having sex and must be left in at least 6 hours after sex. Advantage is the several cap does not contain any hormones and can be used by persons who are breastfeeding. Disadvantage is higher failure rate compared to other types of contraception, including the diaphragm, and can increase risk of toxic shock syndrome (TSS). Side effect of cervical cap. From the spermicide, irritation of the vagina and surrounding skin or an allergic reaction, strong odors, or vaginal discharge if the cap is left into long, an allergic reaction to the material in the cap. This is rare changes in the cervix because of irritation. Male condoms. During sex, you wear the condom on your penis to prevent semen and sperm from entering your partner's body when you ejaculate cum. Advantage of male condom is they are the most effective protection available against STIs, and they do not affect future fertility for either a woman or a man. Disadvantage is some people are embarrassed to use condoms or feel they may interrupt foreplay or intercourse. Side effect of male condom. Most people can use condoms with no problem. There are no side effects. Rarely, latex rubber condoms can cause irritation for people with latex allergies or sensitivities, and sometimes the lube on certain types of condoms may be irritating. Female condom. Internal condoms are inserted into your vagina any time before sex, but must always be inserted before a penis touches your genital area. Advantage of female condom is female condoms help to protect both partners from STIs, including HIV. Disadvantage is some couples find that putting in a condom interrupts sex. To get around the inserted in advance or try to make doing so a part of foreplay. Side effect of female condom. When used correctly, they're a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Surgical methods. A minimally invasive procedure in the belly cavity that uses a tube with a light and a camera lens at the end, laparoscope, to examine organs and check for abnormalities. Advantage of surgical methods is reduced post-surgery pain, less blood loss, fewer and smaller scars. Disadvantage is it requires surgery, usually low, of surgical complications such as internal bleeding, infection or damage to the other organs. Side effect of surgical methods. Pain. During right and after surgery, a surgeon typically works with the anesthesiologist to manage pain using medication to block the awareness of pain, called anesthesia fatigue, appetite loss, problems with other parts of your body, swelling, drainage, infection, bruising. B. Natural methods. Abstinence. Abstinence is the most effective form of birth control. If two people don't have sex, sperm can't fertilize an egg and there's no possibility of pregnancy. Other forms of birth control depend on barriers that prevent the sperm from reaching the egg, such as condoms or diaphragm. Advantage of abstinence is free, always available, and can be started at any time in your life. Disadvantage is experience house that even people committed to abstinence many unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Side effect of abstinence. Anxiety and stress, memory, relationship, health, immune system, vaginal walls and lubrication, prostate cancer. Calendar method. The rhythm method, also called the calendar method or the calendar rhythm method, is a form of natural family planning. To use the rhythm method, you track your menstrual history to predict when you'll ovulate. This helps you determine when you're most likely to conceive. Advantage of calendar methods is women can also work out when they are potentially fertile and when they are definitely infertile. Disadvantage is it's not as effective in preventing pregnancy as other birth control methods. Side effect of calendar methods. There are no physical side effects, and you can use it to plan when you get pregnant. You have to keep a daily record of your fertility signals, such as your temperature and the fluids coming from your cervix. It takes 3 to 6 menstrual monthly cycles to learn the method. Basal body temperature. Basal body temperature can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best day to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Advantage of basal body temperature is helping you gauge the best days to have or avoid unprotected sex. Disadvantage is may not accurately predict ovulation in all women, including those with irregular menstrual cycles. It offers no protection from sexually transmitted diseases. Side effect of the basal body temperature. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Some women may choose to use the basal body temperature method for religious reasons. The basal body temperature method can also be used to detect pregnancy. Cervical mucus method. To use this method, record your cervical secretion for several cycles. Starting the day after your menstrual bleeding stops, observe and record your cervical secretion on a daily chart, either on paper or with an app designed to track fertility signs. Advantage of cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Disadvantage is does not protect against sexually transmitted diseases. Side effect of the cervical mucus method. The cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Symptothermal method. Symptothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. Advantage of the symptothermal method is ineffectiveness because it combines the calendar, cervical mucus, and temperature method. Disadvantage is the method are that intercourse must be restricted to only 7-13 days of the cycle. Side effect of the symptothermal method. Both these methods are associated with side effect, particularly in combination with other medication and tobacco and health complication including mood change, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly, blood clots. Ovulation detection. An ovulation home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone LH in the urine. A rise in this hormone signals the ovaries to release the egg. Advantage of the ovulation detection is test kits may be beneficial if you have slightly irregular period or find other methods of tracking for fertility difficult or unreliable. Disadvantage is ovulation test kits can be expensive and there are no guarantees. Side effect of the ovulation detection. Nausea and headache are two possible ovulation side effects due to the change in your estrogen and progesterone levels. Coitus interruption. Coitus interruptus, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before the ejaculates. Advantage of the coitus interruption is does not affect breastfeeding and is always available for primary user use as a backup methods. Disadvantage, it doesn't offer protection from sexually transmitted infection. Side effect of coitus interruption. Risk. Using the withdrawal method to prevent pregnancy doesn't pose any direct risk, but it doesn't offer protection from sexually transmitted infections. Some couples also feel that the withdrawal method disrupts sexual pleasure.